our population health webinar today. I am Dr. Carol Neal. I'm the chair of the Population Health Committee. And today we have two esteemed individuals that will be talking to us about COVID-19 as it relates to children. And I'm going to introduce both of them to you today. The first person I would like to introduce is Dr. Pamela Bryant. Dr. Pamela Bryant is an assistant professor and board certified pediatric nurse practitioner at the University of Alabama at Birmingham School of Nursing. As a 10-year faculty member, she currently is the specialty track coordinator for the UAB School of Nursing, Pediatric Primary Care Nurse Practitioner Program, and she practices at UAB Newborn Nursery. Dr. Bryant serves in various leadership roles and is a member of several professional organizations, including the National League of Nursing, the National Black Nurses Association, and the Association of Faculties of Pediatric Nurse Practitioners, where she is chair for the Communications Committee. She is also a member of NBNA's Population Ad Hoc Committee and leads the NBNA Pediatric Population Focus Groups. She received the Lamplighters Award in 2020 from the Alabama League of Nursing for her leadership. Thank you, Dr. Pamela Bryant, for agreeing to be a part of our webinar today.
Thank you for having me.
Thank you. At this point, I would like to introduce you to Dr. Tedra Smith. Dr. Smith is currently an associate professor at the University of Alabama at Birmingham School of Nursing and hold a position at Children's of Alabama as a pediatric nurse practitioner. She received her Doctor of Nursing Practice degree in 2020 and her Master of Science in Nursing degree with a concentration in pediatrics in 2004, both from the University of Alabama at Birmingham. Dr. Smith is the Director of Pediatric Partnerships and leads the collaboration Clinical Scholars Program with Children's of Alabama and other pediatric initiatives. The Clinical Scholars Program is a 12-month program designed to increase participation of bedside nurses in quality improvement and evidence-based projects with Children's of Alabama. Dr. Smith was recently elected as the member of at-large for the Birmingham Black Nurses Association and has served as president of the Alabama League for Nursing and chair of the Alabama Coalition of Nursing Organizations. Dr. Smith has several publications in nursing journals related to care of the pediatric population. She currently serves as a column editor for the Pediatric Nursing Journal. She is very involved in community and service through the BBNA and church events. At this point, let's give both of them a round of applause. So thank you, ladies, for agreeing to be a part of our population health webinar starting in January. And at this point, I'm going to turn it over to Dr. Pamela Bryant.
Thank you, Dr. Neal, for that wonderful and warm welcoming. Really do appreciate it. And I also would like to say thanks to everyone that was able to join our webinar today as well. Next slide, please. The objectives are, first, recognize 3 factors that increase anxiety in children. The second objective is to verbalize 2 challenges that children face during the COVID-19 pandemic. The third objective is to discuss the signs, symptoms, and treatment of COVID-19 in the pediatric population. And the fourth objective is to describe the pediatric healthcare provider role and responsibilities related to COVID-19. Next slide, please. So exactly what is a pandemic? A pandemic is defined as an epidemic occurring worldwide or over a very wide area, crossing international boundaries and usually affecting a large number of people. The Spanish flu, also known as the 1918 flu pandemic, was an unusually deadly influenza pandemic caused by the H1N1 influenza A virus. It lasted from February 1918 to April 1920. It affected about 500 million people, about a third of the world's population at the time, in 4 successive waves. And as you know, right now, we all are facing the COVID-19 pandemic. And COVID-19 is different because the country is quarantined and doing social distancing while donning masks. Additionally, the outbreak of COVID-19 in the US has caused many schools to close early and later to start back gradually with virtual or hybrid learning. The outbreak of coronavirus disease 2019 has profoundly affected American families. Most areas of the country have experienced stay-at-home orders. Also, unemployment claims have skyrocketed to unprecedented levels, and millions of cases of the illness have been confirmed. Given the size and scope of both the economic and health effects of the current crisis, it likely has strongly affected the psychological well-being of both parents and children. Next slide, please. COVID-19 among school-aged children in the U.S. from March the 1st, 2019 through September the 19th, 2020, 277,285 COVID-19 total cases in children were reported. Testing increased from 100,081 tests to 322,227 in 60 days from May to July. Positives for COVID-19 incidents increased from 13.8 per 100,000 to 37.9. COVID-19 incidence ages 12 to 17 years was 2 times likely children aged 5 to 11 years. The younger the child, the less likely to have symptoms. However, among school-aged children who were hospitalized, admitted to an intensive care unit, or who died, 16%, 27%, and 28% respectively had at least one underlying medical condition. Next slide, please. This slide right here depicts many emotions that we're facing today as a nation, but our children are experiencing anxiety. Anxiety is a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome, which now is COVID-19. Next slide, please. Factors in children's lives that contribute to anxiety to COVID-19, their social isolation. They're not able to socialize in person with their friends due to social distancing and fear of catching the virus. Also, we have parental job losses. A lot of small businesses around the world have had to shut down and close because of the pandemic. So, excuse me, when a parent loses a job, it affects children of all ages because they can hear and see their parents express signs of being angry, sad, or looking hopeless. Also, there's the illness of a family member or the death of a family member. We all know of someone who has been affected by this COVID-19 virus. Some have lived and others haven't. So, as we know, children are listening to and seeing all of this, and they are also, just increasing their anxiety. There's an increase in violence at home because of families that are working remotely, and due to the fact that some parents have lost their job, and the violence already was there in the home, but now it has increased even more, and that's increasing children's anxiety level during this pandemic as well, because they're at home to see this. And then also there's exposure to the media. As you know, there are all types of devices that children can get their hands on to see what's going on. And as you know, We all are watching the news. The news comes on multiple times during the day. And the first thing that they're talking about is the COVID-19 pandemic. And children see us watching the news, and they see and hear us talking about what's going on, and that increases their anxiety level as well. And they also might have a handheld device, they might have a laptop. And if you go to Google search, of course, one of the first things that comes up is something about COVID-19. So they're seeing that, and it's also starting to increase their anxiety level even more. Next slide, please. I'm sorry, can we go back a slide? Yes, thanks. So some challenges during COVID-19. Again, the changes in the routine. As you know, school isn't the same. They're not going to school. They're not going out there catching the school bus with their friends. Mom's not dropping them off usually like she has been doing. Also with the place of worship, everyone isn't going to church. We're doing it remotely now. And if we are doing it, it's in small settings. Also, if it's an older child and they have a job, their routine with their job has changed. There's also change in their social routine. They're not able to go out to the movies in groups of friends like they usually do, and also dining out. And also going to sports events are limited as well because they're not letting a lot of people at those events. Also, there's a breaking in the continuity of learning. There's virtual learning, they're being taught at home, which can make learning challenging for children who are used to hands-on learning and need the extra assistance that's given in the classroom. You also have children that are special needs and need extra resources. They might need occupational therapy, speech, or behavioral. And sometimes some children were getting some extra needed tutoring at school that they needed. And it can be hard trying to do that at home now to get someone to come to your home with the pandemic going on. Then you also have fatigue from online learning known as Zoom fatigue. Also, there's the break in the continuity of healthcare. Parents aren't willing or they're avoiding taking their child to the primary care physician because of social distancing and the possibility of getting the virus. Another challenge is miss significant life events, whether it's going to a friend's birthday or either having play dates for younger children, going to sporting events, homecoming, graduation. Most graduations are virtual. Some were in person, and they were pretty spaced out during the graduation, but it was still different with everyone having to wear a mask. And also funerals, as you know, that is another challenge for everyone as well as children going to a funeral because it's a limited amount of people that can attend a service, and so that is a significant life event that's a challenge also for them. Next slide, please. When you look at the minority community, you think about the social determinants of health, and they have historically prevented persons from having fair opportunities for economical, physical, and emotional health. When you talk about discrimination, unfortunately, discrimination exists in systems that were meant to protect well-being or health. Examples of such systems include healthcare, housing, education, criminal justice, and finance. Discrimination, which includes racism, can lead to chronic and toxic stress and shape social and economic factors that put some people from racial and ethnic minority groups at an increased risk for COVID-19. Healthcare access and utilization. People from some racial and ethnic minority groups are more likely to be uninsured than non-Hispanic whites. Healthcare access can also be limited for these groups by many factors, such as lack of transportation, childcare, or the ability to take time off from work, communication, language barriers, cultural differences between patients and providers, and historical and current discrimination in healthcare system. When you look at occupation, people from some racial and ethnic minority groups are disproportionately represented in essential working settings such as healthcare facilities, farms, factories, grocery stores, and public transportations. Some people who work in these settings have more chances to be exposed to the virus that causes COVID-19 due to several factors, such as close contact with the public or other workers, not being able to work from home, and not having paid sick days. Educational, income, and wealth gaps. Inequities in access to high-quality education for some racial and ethnic minority groups can lead to lower high school completion rates and barriers to college entrance. This may limit future job options and lead to lower paying or less stable jobs. People with limited job opportunities likely have less flexibility to leave jobs that may put them at a higher risk of exposure to the virus that causes COVID-19. People in these situations, they often can't afford to miss work even if they're sick because they don't have enough money saved up for essential items like food and other important living needs. When you look at housing, some people from racial and ethnic minority groups live in crowded conditions that make it more challenging to follow prevention strategies. In some cultures, it's common for family members of many generations to live in one household. In addition, growing and disproportionate unemployment rates for some racial and ethnic minority groups during the COVID-19 pandemic may lead to a greater risk of eviction and homelessness of sharing of housing. Next slide, please. So our role, community and faith-based organizations, employers, healthcare systems and providers, public health agencies, policymakers, and others all have a part in helping to promote fair access to health. To prevent the spread of COVID-19, we must work together to ensure that people have resources to maintain and manage their physical and mental health, including easy access to information, affordable testing, and medical and mental health care. We need programs and practices that fit the communities where racial and minority groups live, learn, work, play, and also worship. Next slide, please. And now we will have Dr. Smith to do her presentation on COVID-19 and the pediatric provider role.
Thank you, Dr. Bryant. Good afternoon, everyone. Thank you all so much for being with us today. I'm going to spend a little bit of time talking about COVID-19 and the pediatric provider role. Next slide, please. So children comprise about 22% of the U.S. population, while they only comprise about 7.3% of all cases of COVID-19. As we just heard, Dr. Bryant reviewed those numbers that we were able to see in 2020 of the children affected with COVID. Now, the rate of infections are steadily increasing as of that time period. However, the severity is not increasing as far as we know. The true incidence is not completely known related to the increased risk for multi-system inflammatory syndrome in children, but we do know that more and more children are testing positive for COVID, although they're not having any symptoms. And like I said, there's some underlying medical conditions for those that are testing positive and are having severe reactions. Those that are not having any symptoms, typically they are the normal healthy child, has a family member that was in close contact with COVID-19 and they got it that way. So it's not that they have any other underlying medical conditions that's causing issues for them to have a severe case. But what we're seeing are those children that have asthma, those children that have diabetes, those children that have other compromising medical history have those more severe reactions to COVID-19. Hospitalization rates for children remain low, but what we are seeing is that those minority children that are testing positive for COVID-19 are the ones that we're beginning to see. African Americans, Hispanic, Latino children, those are the ones having the severe reactions, but that's also the population that we tend to see more underlying medical conditions such as obesity and asthma, as well as type 2 diabetes and diabetes mellitus. So that is what we're currently seeing. Next slide, please. Now, recognition of these is highly important for anyone working with a pediatric population. You're going to have fever, or persistent fever, so not just a fever that's one day and goes away. This is a persistent fever even after taking fever-reducing medication. There's abdominal pain, and usually that's going to be accompanied by diarrhea and vomiting, and this is usually not one episode. It's kind of persistent, just like the fever, just something they just can't quite get over. Oftentimes there may be a skin rash associated with it. They may have some mouth lesions associated with it. May get some laboratory studies and see that their CRP and ferritin is increased, as well as cardiac enzymes. But before you get to that point, it's important to recognize that these symptoms are very similar to the flu. They're very similar to upper respiratory infections. They're very similar to sinusitis. So it's important to keep that in mind as we are seeing these patients come into our clinic, that we can't just jump to COVID, but we want to include COVID in our differentials, especially given the pandemic and how severe we've seen that be. But keep those other things on your list of differentials as well. Next slide, please. Now, the responsibility of the primary care provider, of course, is always to advocate for children and their families. So that's ensuring that children and family get what they need. That's weighing in on these decisions about whether or not they should be going to school or doing remote learning, weighing in on their meals that they're getting, all of those things, policies and procedures that affect children and their families. As primary care pediatric providers, we should be advocating and staying involved in those types of scenarios, educating about good health look like for children and their families. We should ensure that they're getting that during this time, especially when a lot of these children are not in school, so they're not getting those meals that they're used to getting throughout the daytime. Testing patients as needed. A lot of the primary care offices are not testing, but being linked up with referral mechanisms to get these children tested, especially when they have family members or they're the ones that are going to school. If someone in their class is diagnosed, we need to get these children tested in a timely manner. Maintain available times for routine appointments. As Dr. Bryant said, it's very important for these children to continue to get their annual well-child checkups in, get those immunizations that they may need. It's very important that they're getting their dental exam and their eye exam. So maintain available times for those routine appointments, whether it's seeing well patients in the morning and sick patients in the afternoon, or flip-flopping that schedule, but making time to see those routine appointments as well as those sick visits is very important, while maintaining safety for those patients. Continue that shared decision making with parents. It's very important to engage with the family, have conversation with the families to see what's important to them, what kind of assistance and resources do they need. So maintaining that shared decision making. It's not just one-sided. Trusting relationship with a healthcare provider shouldn't be one-sided, as in I tell you this is what you need to be. It should be a conversation between, okay, this is what we recommend. Let's see what we can do to modify this so it works with you and your family lifestyle. You want to maintain a safe practice area, so putting up signs to alert people to wear their mask and maintain social distance. And what I've seen a lot of primary care offices are doing are you call to arrive and then not calling you in until they can safely put you in a room close to the door, and you keep your mask while you're in that room, and you only come out if you need to get your weight checked or something like that. So avoiding those crowded waiting areas by having people just wait inside their car until you have an available space. And then identifying opportunities to improve health outcomes. Every single time you're in contact with a pediatric patient and their family, you should be doing a thorough assessment to see what can you address, not just what they're there for in that chief complaint, but what other things can be addressed while they're there. Next slide, please. Some considerations, not just with COVID, it's just a clinical presentation. Like I said, getting a very thorough history. What supportive care do they need? Are they having transportation issues so they can't get to the school to get the free meals every day, having issues with finding childcare. What resources can you already have at the clinic or available to be able to provide to these families? I implore you to go ahead and try to do that. Do they have underlying medical conditions? Ensuring they have appropriate treatment for that, assuring that they're following with their specialty provider that may be coordinating the management plan for that, ensuring that they are getting all these things. It may involve telephone calls, it may involve text message reminders, doing whatever you can to ensure that child's underlying medical conditions are being taken care of. And then always assessing the home environment. It goes back to those socioeconomic things that Dr. Bryant discussed earlier. Assessing that home environment. Do they have an adult that can be there in the daytime? Do you need to help them coordinate to find somewhere else for their child to go during the daytime since they're doing virtual remote learning? Do they have food, or have they had a loss of a job and need help, financial assistance to be able to afford food? So assess the home environment and then determine what resources you may have within your clinic or resources that you may know about in regards to the community. Next slide, please. There are some emergency warning signs related to COVID, so I encourage you to educate children as well as their family on those warning signs. They're, like I said, the symptoms resemble the flu. It resembles a common cold. So some people are just uncertain. Some people don't want to go to the ER, as Dr. Bryant mentioned, because they're afraid of contracting COVID there. They're afraid of it being crowded, and so they've just been avoiding the emergency department. Census is beginning to pick up just a little. That's primarily where I practice, but we still see a 80% decrease than what we normally see this time of year for children in the emergency department, which is concerning, hoping that that means because they're at home and not going to school that they're well, but we have a strong suspicion is that people are just afraid to go. So kind of educating that is go to the ER. For warning signs such as trouble breathing, such as new confusion, such as inability to wake or stay, addressing racial disparities, you want to confront implicit bias. Cultural humility is very important, not just when caring for minorities, but when caring for any type of patients. We all have those biases where we need to do a self-assessment and determine, okay, what biases do I have, and do that self-critique of what I need to do to address those biases when dealing with our patients. We need to design and implement quality improvement strategies to address those biases that we may identify within ourselves or within our practice. We want to develop partnerships with children and their families. So it's very important when dealing with children and their families to reach out to community. Children spend a lot of their times in community settings, in schools, in daycares, in YMCAs. So it's important for us to build those networks so we know what resources are available. We can educate those people about dealing with children and their families, and we can be intricately involved in that and addressing the social determinants of health. We can speak to that over and over again, that it's important that we assess the whole picture. We need to get a whole picture. That's home environment, that's past medical history, that's social history as far as are families working, are the parents working, are they together, do they have an adult inside the home? All those things are important to addressing all the health needs of a pediatric patient. And then above all, providing family-centered care, and which means we don't just take care of the child, we also take care of the entire family. Next slide, please. So COVID-19 and the parental role. I want to talk a little bit about parents during this COVID-19 pandemic and things that we as pediatric providers can do to assist our parents. Next slide, please. One thing we really want to do is have our parents stay calm and stick to a routine. Normalcy is really important during this time. Kids have been pulled out of school. They're not able to see their friends and do their usual day-to-day activities. So it's important as much as we can to build a sense of normalcy by creating a new routine that we can do. Staying calm. We're all stressed. We are all filled with anxiety, as Dr. Bryant discussed earlier. So sticking to that routine is very important. Allow the child child to feel their emotions. They feel things just like we do as adults. They're going to be frustrated. They're going to be angry. They're going to be stressed because things are different. They're sitting in front of a computer screen most of the day. They're not able to go outside and play with their friends. They're not able to have play dates. They're not able to celebrate their birthday the way they would want to celebrate it. So allow them to feel those emotions and then talk to them about those emotions to help them deal with it. Monitor what information the child hears. As mentioned earlier, there's all kind of devices. When you turn on the news, they're talking about COVID, they're talking about all the things going on with the presidency. So they're hearing all that and they're taking it all in. Even when you don't think they're listening, they're listening. They may be in another room, but if the TV's up loud, they can hear all that. They can hear things on the radio. So you want to monitor what they hear, what conversations they're hearing you have over the telephone, because they're taking all that in and then they're going to express emotions around it. Welcome distractions. We want you to follow a routine, but welcome those happy distractions that may be a family member calling to do a FaceTime, maybe a family member doing a drive-by. Welcome those nice, gentle distractions. Take a walk outside every day to get a sense of peace of mind. Have 15 minutes to go outside to let them ride their scooter or ride their bicycle just to get out. You still want to maintain those rules you have in place as far as doing chores, as far as being considerate and nice and kind. Maintain those rules that you already had in place. You don't want to bend too much because they need that for their development and that sense of normalcy. And then you want to watch yourself. We want to educate parents to take care of themselves, but also monitor their own behaviors. And when they feel themselves getting agitated or frustrated, taking a break themselves to kind of deal with that and then coming back and talking to the child. Next slide, please. Now, we want to stress that even though the vaccine is going out, it hasn't been approved for children less than 16 yet, but what we want to make sure is that we continue the infection prevention, and we want to educate parents to not get lax. It's very easy to, honestly, it's very easy to get lax and forget about hand washing and forget about putting the mask on and pull it down and forget to pull it up and not eat a healthy diet. So as primary care providers and pediatric providers, we need to remember to continue to educate on that infection prevention and sending out reminders as much as we possibly can until we have this under control and restrictions can be released a little bit, but we need to continue that for the time being. Next slide, please. Other tips for parents is the school systems are offering a lot of resources. A lot of schools are offering pickup meals where you can drive to the school and they'll give you lunch and then they'll give you something for breakfast the next day. There are resources that are available for learning how to use the different computer softwares and systems that the kids are using. So encouraging parents to utilize those free resources that are available. As I said, spending time outdoors, getting that fresh air, it does more than parents realize to help calm them down and help deal with stress. And children are used to that physical activity. Most children have at least 45 to 60 minutes of physical activity that children are doing every day. So taking them outside, giving them a chance to do that. Days that is raining, having things indoors that they can do to kind of exert some of that energy, besides getting on Nintendo Switch and those gaming systems and iPads and things of that nature. Incorporate some fun activities. I know it's hard being a parent myself. It's hard. And as providers, we have to acknowledge that when we talk to our parents, that we know it's hard, and here are some fun things that you can do. There's coloring, of course, there's drawing, of course, there's doing drive-bys, there's going to parks on nice days, just incorporating those fun activities and having a baking contest for some of the older kids or little things like that that you can do to just do some fun activities to relieve some stress. Planning out the week is not only important for the child, but it's also important for the parents. Having that routine, as I discussed earlier, taking that Sunday night to kind of sit down and plan out, okay, this is my schedule for the week. This is my child's schedule for the week. How do we merge those two? And think active time on technology. I'm not going to say time on technology is always bad, but think active time. You know, can they do an educational game versus just playing a Lego game or something like that, or a basketball game? Is there something we can do that's a fun yet educational on their technology piece? And then just remember to breathe. Remind your parents to just take a deep breath and breathe. We're all living through this together. There's nothing we can do about it. The scientists and doctors are doing what they can. So we need to remember to just breathe and do just what we can. Next slide, please. The implications for practice include following the CDC guidelines. That is what we're sticking to right now. That's what the government is sticking to. So making sure that we as providers are following those CDC guidelines, separating those sick and well patients, sending reminders to parents, especially about those well child visits that sometimes, even regardless of the pandemic, kind of gets dropped off their radar. Use opportunity to administer vaccines, and I can't stress that enough, maintaining those immunization schedules every opportunity you can, helping families navigate this information. Some things on the CDC, they are in lay terms, but they still might be confusing. So helping families understand what that means to them, helping them understand specialty management plans that they may get is important. Ensuring that we are educating on signs and symptoms, educating on health prevention, and then evaluating for those signs and symptoms of stress and anxiety and depression, as well as child abuse. We can't forget child abuse, which we've seen an increase since COVID-19 because children are at home more, parents are losing their jobs. It's frustrating and stressful. So we've seen a lot more of that child abuse. So remembering to a survey for that and address that. And then, as I said earlier, promoting those physical activities and daily healthy behaviors and using telehealth to engage with your families as you can. Next slide, please. Here is a list of references that we use for this presentation and that we recommend you using to get more information about how you can help children and their families deal with this pandemic. Next slide, please. And thank you so much. And at this time, we'll take questions.
Thank you so much for that great presentation. I actually learned a lot. I've never thought about, I didn't realize child abuse is increased because you're right, all of the anxieties, you lose your job and the poor child is right there. I didn't know they had drive-by lunch where you actually can go to school and get lunch and breakfast the very next day. That was phenomenal. So at this point, we're gonna open up the chat box and I have several questions. And one of the questions is, let's see, where do I want to start? You guys have several. Do you think it's appropriate to allow children to watch the news reports related to COVID?
I'll just answer and then I'll let Dr. Smith add on if she has something to add on. I personally think it's okay to let them know what's going on so that they'll be familiar with certain terminology and won't be afraid of it. But I don't think that we should just let them continually watch the news, and because you get so many different messages when you're listening to the news. So I think that, you know, if we as parents sat down and talked to our children about what's going on, and we don't watch it constantly every day, I think that will help them to not be as anxious as they are. But it also helped them to be aware of what's going on so that they can know that this is serious and that I need to wear a mask and I need to wash my hands and I do need to maintain social distancing.
Okay, thank you.
I definitely agree with Dr. Bryant on that.
Okay, well, my next follow-up question would be from from the chat box. I would like to know, at what age should you begin to discuss the COVID-19 crisis with children? I know children are different and learn at different rates.
No, I would think school age children, they can understand, you know, those school age children understand what you're talking about. When a lot of parents are hesitant because they don't think they can understand, you can just give them an example of technology. They understand technology better than we do. So we can always, you know, I can't remember the name of the book, but it's a book about germs. It's just really simple. You can go back to something like that and just talk to them about a germ, a basic germ, and relate that to COVID-19, and they will understand. I think it's just how we present the message and the information to the child when they're younger. But you know, the older children, they understand also. That's my thoughts on it.
I agree as well. Thinking about it from a developmentally standpoint, approaching it from that. But I think starting at kindergarten, they're old enough to understand some components of it, because health prevention education starts in daycares actually. So I think definitely sitting down and having that conversation on their level is important.
Thank you. Dr. Smith, this is another question from the chat box. Can children get the flu and COVID vaccine at the same time? Is that possible?
So children can get infected with COVID and flu at the same time. Right now, the COVID-19 vaccine is not approved for children. One of the vaccines is approved for 18 and above, and one vaccine is approved for 16 and above. So it's not approved for those younger than 16 right now. So we do encourage that they get the flu vaccine. So you want to prevent what you can. So getting that flu vaccine, and then as soon as it becomes available, getting that COVID-19 vaccine. Children were not included in the initial piloting and studying of the vaccine, which is common. Typically, they choose healthy adults to test it on first. So we're waiting, and hopefully by the end of this year, early next year, we'll have a vaccine for all ages.
So based on that, at what age should children start to wear masks? That's another question in the chat box.
The recommendation right now is the age of 2, that children wear a mask at the age of 2. And I understand some families are struggling with that because the child doesn't quite understand, but keeping them away from high traffic areas as much as you can. But the recommendation is to start at the age of 2 wearing a mask.
Okay, thank you. And the next question is for both of you guys. Do you recommend that parents seek out mental health services for their children who many will be having a difficult time coping because of COVID?
I think that they should. I think they should talk with their primary care physician, and their primary care physician should be able to recommend them to perhaps first start talking with a counselor. And then if they need someone beyond that, then they can recommend that. But I think it's really helpful for them to do that, because sometimes children can't talk to us, or sometimes as parents, we're impatient and we don't sit down and listen to what they're saying, or especially if they're older, they might say, you don't get what I'm saying. So yeah. I think we should seek help from our primary care physician so that we can get them some help, especially early on, if they're coming to us and we feel like they need it.
I definitely agree with Dr. Bryant. It's important, if you feel like your child needs that, then seek it out. We as minorities tend to be hesitant to seek mental health services. And so we want to be a role model and encourage it. If you feel like your child needs that because they are struggling, then please don't hesitate. And as providers, we have to help families understand that.
And I have a follow-up question. So are you guys seeing a decline? And this is from the chat box. Are you continuing to see a decline in parents making sure their children get their immunizations and their children checkup visit? Are you seeing a decline in that?
We're steadily. Go ahead, Dr. Bryant.
I just want to say, I work in a newborn nursery, and parents are very hesitant when it comes to vaccinations. And usually I just sit down and talk to them about the reason why the child is getting a vaccination, and I'll give them information regarding the vaccination. And then I always bring up COVID-19 and say, look, you guys, this is what's happening now. And I tell them, I say, you know, we don't know what the other person has, whether or not they've been vaccinated. And I say, you know, this lovely baby that you have, you don't want just someone to hold your baby and they might, let's just say, have hepatitis B, and you don't know that because we're not going to immunize your baby because you don't want it. So I tell them they need to sit back and think about it. I'm not going to force them to do anything, but I'm going to give you the information and let you read. I know what you read over the internet, but read it and then make an informed decision from there. But a lot of them are hesitant from what I'm seeing. What about you, Dr. Smith?
Yes, kind of seeing the same, that it's kind of been steady, not necessarily a big decline, but still seeing a lack of immunizations being received. So much so that the production has slowed down because the immunizations that have been produced aren't being used.
Okay, Dr. Smith, and this is a really good question from the chat box. Is the vaccine safe for someone who's allergic to eggs? Like my 18-year-old can't have the flu vaccine.
Right now, the recommendation is that if you have a severe allergic reaction to anything, not to get the vaccine, just because, once again, those people were not included in the study. So they're advising people, if you've ever had an anaphylactic reaction to anything or severe allergy, not to get the COVID-19 vaccine right now. They want to do more tests and studies on it.
Okay, that makes sense. Did you have anything to add to that, Dr. Bryant?
I just want to say that this is totally adult, but I just want to go out and say that Dr. Smith and I both have had the COVID-19 vaccination. I've received both of the vaccinations, and I know there are a lot of horror stories out there, but you know, everyone experiences something different. And I just only had a sore arm. I mean, really sore arm, not your ordinary sore arm, but it was sore. It felt really heavy sore for a couple of days. And even after I got the second vaccination, you know, my arm was just sore. So I didn't experience any other side effects other than that. So I just want to kind of put that out there for the adults to hear, you know, as well, coming from, you know.
Thank you. Well, the next question from the chat box: what techniques do you recommend to teach children to wash their hands for the time recommended? What techniques?
There's a lot of educational videos available. We've actually, Dr. Bryant, myself, and some colleagues have done some videos that we put on YouTube, and we'll be happy to share those with NBNA to share, but they're all kid-focused videos that we've done. But basically, role modeling is best. We encourage children to sing the happy birthday song twice while they're washing their hands, and we say front, back, under nails, and sing the happy birthday song 2 times, because that's about 20 seconds, and that's what we encourage, about 20 seconds of running water, washing your hands, lots of soap, and getting all the way around. So just role modeling, watching those videos, letting children watch those videos, because in the videos there are actually children, so little kids that look like them is really what tends to work. So I encourage you to download those videos. The CDC has step-by-step instruction, but then you as a parent or a provider actually role modeling.
Thank you. Thank you. And my very last question from the chat box: have you met any parents who voice hesitancy on getting their children vaccinated for COVID when it is available? Do you have any children, any parents already telling you right now, I'm sorry, when they make it available for children, my kids are not going to get it? Are you guys experiencing that?
I haven't met any parents to say that to me. They all ask me, when will it be available for children? And I say, I'm not sure just yet, you know, when it's going to be available. But the majority of parents want their child to be vaccinated because they want them to go back to school.
Yes.
I'm being for real. They want them to go back to school because they are saying, I'm not a teacher. And I said, I totally understand. It's hard trying to work from home and teach your child when you're not used to doing that. So most of the ones that I know, they haven't, you know, they want to know when it's going to be available.
That makes sense. So, Doctor, at this point, I would like to close out the chat box. Thank you so much. And I just want to give you guys an opportunity to give us final parting words before we end our webinar today. And I'll start with Dr. Smith. Any final words you would like to leave with our group?
I just want to encourage everyone, as you interact with children and their families, to remember that they're not little adults. They're children. They think differently. Their developmental level is differently. So making sure you encourage other providers and other parents to make sure that they speak to them on their level. They do feel emotions that are very similar to ours. So don't what they're saying, what they're feeling, because they feel frustrations and stress and anxiety just like we do. So I encourage you, have that conversation with them, be willing to help them create a sense of normalcy and routine to support them as best you can as a primary care provider, and to wash hands and keep wearing your mask, and we'll get through this together.
Thank you. And I'll give the last final word to Dr. Pamela Bryant.
Yes, I would kind of like to echo what Dr. Smith said. Please continue to follow the CDC guidelines. Please continue to wash your hands, use hand sanitizer. Please wear your mask. I know now they're thinking about possibly donning 2 masks as opposed to 1.
Wow.
You know, 1 cloth and maybe one of those medical, you know, the
N95 or
yes,
something like that.
2, but to have 2 until we can get this under control. And also I want to say, if you don't have any young children, but if you have family members that have young children, and if you look at them and see that they look like they are stressful or having anxiety, just talk to the parent and just say, hey, I went to this and listened to this webinar and they were talking about that. And just ask them to talk to the child, just see what's going on with them. And if they need to take them to the primary care physician to perhaps let the child have some counseling, just encourage them to do so that we won't, you know, have fear, you know, the wrong type of fear instilled in our children. Those are the last words I have to say. Thanks.
Well, at this point, I would like to say thank you, everyone, for joining us with the NBNA. We are the Population Health Committee, and I'm the chair, Dr. Carol Neal. And every month, we try to come up with a chronic condition or a very important topic to address, to share with the membership and anyone who's interested. So thank you for joining us. And thank you again, Dr. Bryant and Dr. Smith, and everyone have a great rest of your day. Thank you.
Thank you.
Bye-bye.
Thanks. Bye-bye.
Bye-bye.
Bye-bye.